Hello, 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 everyone. And this is the Inflamed Sisters Thriving podcast, a safe space created to guide women living with chronic illness to uncover their purpose by doing what they were meant to do, move in power by advocating for themselves, and accelerate their growth in health, career, and business. You will learn how to stop hiding and start thriving. We will inspire, educate, and motivate you as we show you Inflamed Sisters Thrive Together always. My name is Katina Morrison, and I am your host, a registered nurse and chronic illness coach who has the amazing opportunity to interview our amazing guest, Dr. Singla. How are
Hi.
you doing today?
Good, good. Thank you so much for having me today. It's a pleasure
Thank
to be here.
I appreciate it. The pleasure is all mine.
Oh,
And I must say, I would love for you to introduce yourself to our guest.
sure, sure. So my name
Mhm.
is Dr. Saimun Singla. I am a board certified pediatric rheumatologist in Houston, Texas. I also recently finished a fellowship in integrative medicine through the University of Arizona Andrew Weil program. And I was in academics my entire career, but as of 3 weeks ago, I opened my own private practice here in Houston called Rheum to Grow, RHEUM, to grow. And for kids with chronic illnesses, taking a more of an integrative approach to their care, which means I blend the regular conventional medicine, labs, medications, imaging procedures, along with the integrative approach of mind-body therapies, diet, supplements for those that need it, how to build resiliency, basically teaching you how to live and thrive with a chronic illness. And a lot of it is just inspired from my own pain points as a patient with rheumatoid arthritis. And I got that diagnosis after becoming a rheumatologist. So my journey is a little bit different than others. And so everything I've learned, I'm trying to pass on to the kids.
You know, that is one of the things that drew me to you. And that was that you actually have a connection to rheumatoid arthritis, inflammatory disease,
Mm-hmm.
rheumatic disease yourself. And that's something we don't always see in our doctors. So I want to congratulate you on your new practice,
Thank
Room
you.
to Grow, located in Houston, Texas, y'all. So definitely go check her out
Thank you.
and support in any way you can this amazing doctor. And as we go into this, you're going to learn more about why I say this because Katina doesn't lie. When I say amazing, this woman is not only amazingly beautiful, but she
Oh,
is an amazing person inside and out.
you're so
So
sweet.
thank you. That
I
makes
need
me
I
feel
need a
so
lot
good.
of you in my life, just every day, like affirmations from Katina.
You know what? We can do that. Let's work that out. I'm working on an affirmations book, by the way,
There
so
you
we
go.
might really, really work this out. So let's get into this. I came in contact with you through social media, through Instagram,
Mhm.
and you are doing a lot to raise awareness in regards to integrative medicine. One thing I would like to know is what really connected you to integrative medicine? What made you actually want to take that particular route
Yeah.
and kind of explain more about what it is?
Sure. Yes. Yes. So integrative medicine is different than alternative medicine or functional medicine. What it is it blends all evidence based. So it basically blends Eastern and Western medicine together. And when I say Eastern medicine, these are things like acupuncture, Ayurveda, meditation, yoga, all those type of things, all based in evidence. So we don't give acupuncture to everybody. It's only for a certain group of patients where there's studies showing that there's grade A evidence or grade B evidence that acupuncture could help your migraines or back pain. And so in the management of rheumatic conditions, that's really important because this is a lifelong condition, right? It's not like your arthritis is one and done. For very few, that is the case, but for the majority, they kind of have this waxing and waning course. And so the biggest thing is, okay, well, we have medications on board, but it's possible that you might flare. So are there ways that you can predict that? Are there ways, other things you can be doing besides the medications to optimize your overall health? And when you get trained traditionally, like I did and many other doctors, you learn how to treat the problem at hand, right? Like, here's arthritis, here's lupus, these are the medications we need to give. You take this once a day, twice a day. you put them on a regimen and you hope the inflammation goes away, the organ damage decreases, and you're in remission. But there's so much more to the story than just that, right? That would be so ideal if it was just that simple. Things like how well you're sleeping, how much you're exercising, what you're eating, all these are sometimes overlooked, and they can add to the fuel that is your immune system. Anything tickling it, anything activating it or tipping it over can activate that immune system and that inflammatory response that we don't want. So it's important to learn what those triggers are, what those foods are, what the hours of sleep minimum for you are earlier than later, because you're going to be living with this for a long time.
Wow. See, what I am so proud of is that not only do I have you on my podcast, but that you're sharing these things from a doctor perspective, having a doctor's voice into hearing the importance of all of those things. One of the
Right.
things we found in our community and is that many in the medical field, and not all, because you're proof of it,
Mm,
many in the medical field are sometimes medicine driven or science
sure.
driven, rather than seeing the science and the benefits that come from natural and holistic methods. And then the fact that you can combine them. I'm a
Correct.
person who has always, as a nurse, because my degree is science
Hmm.
based as well, believed in the combination.
Hmm.
Because for me, going into remission or forever, or thinking that there's a full cure for my condition through just fruits and vegetables, I know it's not possible for
Yeah.
me. And I've had that experience where I'm like, oh, I think I may not have to. I might, but no, I
Hmm.
needed that next Humira injection.
Right.
Or
That's a
so
reality for so many people out there.
yes. And that's what I appreciate about what you're saying is the marriage, the integration of the two. So, how did, now that we know what integrative medicine is, because we've heard of functional and we know what we see as traditional medicine or
Hmm.
westernized medicine, for example,
Right.
but how did your journey start
Yeah.
with, in the sense of your rheumatoid arthritis journey?
Sure. So I didn't get the diagnosis till after my second pregnancy, which I had graduated fellowship and I was an attending, I think, for a year or so by that point. And I started to get this fatigue, like extreme fatigue, and a lot of joint stiffness and pain in my fingers. And I was just like, I'm a new mom. I might be after breastfeeding, I'm also a newish attending, just adjusting to life and the stressors. But then I finally got in to see a doctor, poor person, uh, on their lunch break. And I was thinking like they're just going to say, it's okay, we'll keep watching. But it was very consistent with inflammatory arthritis. And uh, it took me a minute to kind of wrap my head around that diagnosis of like, wow, are you serious? This is a diagnosis that I give to people all day long. And now all of a sudden I carry this diagnosis. I wasn't ready for it mentally. I really just wasn't. And so I was in a little bit of denial at the beginning. Um, and then once I started the medication and kind of wrapped my head around the fact that this is what it is, not only did I get better, but it was also kind of like, all right, so I'm always like, what do we have to do to get from point A to point B? Like, I'm just naturally an optimistic person, and I'm a planner. So those two personality traits kind of put together got me to be like, all right, what else can I be doing? What else should I be doing? And that kind of led me into the integrative medicine rabbit hole, let's say, because I was hoping just to get like a few tidbits here and there. And then everything I read was like, well, we don't have enough studies on this, but I just kept reading and reading and reading and more. And it led me on to this whole fellowship of 2 years of, what else should you be doing based in evidence for inflammatory conditions like this? Should I be taking turmeric? Should I be taking, what is turmeric? What is curcumin? What is omega-3? What are probiotics? So it was a whole new learning process for me, a lot of knowledge, a lot of new education. And I'm really glad I did it because these are a lot of the questions people ask in clinic. And usually as a traditionally trained person, you're like, I don't know, you probably shouldn't be doing it because, it's not a standard of care. And from the flip side, as a patient, you're like, I understand that it's not the standard of care and I'm not going to replace my Humira with fish oil. But do you think it's beneficial at all to add it in with everything else I'm doing. So those, it just became like a very much a, the patient's lives and my lives were running in parallel at that point. So when they would ask those questions, I'm like, yeah, I have the same exact questions as you. Let me do some more research. In fact, let me just do a fellowship and I'll come back to you and answer these questions.
Wow. So you took on more school, more education.
It was a drop in the bucket at this point. So I was like, I think it'd be more helpful than not. So why not?
Wow. That's amazing. Like I knew I loved you from the moment I met you,
Thank you.
but you actually not only you were a rheumatologist already.
Yes, I think
And
I had many years of, I don't even want to count how many years of training that was, but yes, like I said, it was a drop in the bucket. And I think it more has to do with the mindset of I am a lifelong learner. I don't view it as like,
mm,
let me finish this and then I'll get to the point where I need to be. It's more like I'm learning along the way so I can still help people while I'm doing that.
yes, but you also considered how could you better serve this community?
Right.
How could you better be of assistance to them? You're currently in these shoes as a person who was newly diagnosed,
Mm-hmm.
and now, and what would you do? You would sacrifice more of your time and energy to be able to serve them more effectively because they're not them anymore. It's us.
Right.
What can I do to benefit us as a community?
No, you're
Wow.
so correct because that feeling of not being able to help somebody when they're here to see you and they have blocked out their day to do this or canceled whatever they needed to, and you're like, sorry, I just don't have an answer for you or I don't know how to help you. It's not a great feeling. And to do that
Mhm.
over and over again, day in and day out, when they're asking the same questions, you start to notice a pattern. You're like, no, I should be able to say something half intelligent, right? So that's when I was like, I think I should just do more research on this.
Wow. Okay. Like when people hear this, it's because I'm going to tell you it dispels a lot of the images that people form regarding medical professionals because sometimes they don't understand that a doctor cannot know everything about all 10,000 or more diseases that exist in the world. It's
Right.
not possible.
No.
But we go to doctors for the answers. But when a doctor like you, though, says, I don't have the answers, so let me go find those answers for them, that's like, that's one of the most compassionate things that I
Oh,
have ever heard a doctor do.
oh, thank
Um,
you.
so girl, I'm almost speechless. Like my heart was like fluttering. Like this, I need to move to Houston.
You
I
should
know I'm
come
an
to Houston.
adult.
We
Like,
could do a lot together. I
yeah, a
think at
lot.
the end of the day, it's more like, how can I best serve you with, like, I've spent my entire career in life, like many, many nights in the library, not missing out on birthdays, weddings, all these things, so I can help people. This is just another addition to that. This kind of goes along with that theme. It doesn't bother me. This is kind of
Mhm.
what I'm want to do when I'm what I feel passionately about. So it doesn't bother me at all. I just want to be able to help others. That's it.
She was built to do this, y'all. You heard that? Because let me tell you something. I got that BSN. I got that bachelor's in
Yeah.
nursing, and a sister said, you know what? I barely made it through with my health in one piece. Now I graduated,
You were
sister. The
good.
scores were good, but it's because what was happening was I was having flare ups of rheumatoid
Mm,
arthritis and fibromyalgia throughout my schooling, but I
gotcha.
was being experiencing medical gaslighting to a degree. I know
Mm,
that's probably not a term doctors like to hear or other
right.
health professionals, but I was being told, "Oh, it's because you're tired. It's because you need to get more rest."
Mm-hmm.
Um, you know, it can't be rheumatoid arthritis, even though your tests are saying it is, but you're just too young for this. I
Oh
was
wow.
passing out. I almost missed out on finishing my preceptorships and things for
Wow.
nursing because once you hit that third absence, they're
Mm-hmm.
like,
Why are you gone?
you're out. Okay, we can't do anymore.
Right.
But It was a challenging time for me, education. I believe I would have done more schooling had I not been so ill throughout my education
Right.
from the stress and from not getting the answers as far as my health, and then the endometriosis on top of
Mm,
that.
got
Mind you, all of this was not diagnosed until I was 32. I was diagnosed with rheumatoid arthritis and fibromyalgia. 34, I was diagnosed with endometriosis. 36, I had to have a hysterectomy.
Wow.
So then the symptoms started from childhood. And that's why I wanted to interview you too,
Mm,
because my symptoms actually started before my menstrual cycle started when I was 11, but
mhm.
my symptoms of rheumatoid arthritis started before then. The doctors would explain it as growing pains and
Got
not as actual joint pain related to an autoimmune disease. We have exciting news for you. Nurse Loves Essentials, also known as the Inflamed Sisters Thriving podcast, will be hosting our first annual Inflamed Sisters Thriving Summit and Gala on Saturday, October the 29th, 2022 at the Seminole Garden Center in Tampa, Florida. You can attend this event both live, in person, and virtually. Expect to be inspired to achieve strategic growth in health, career, and business as expert speakers speak on these topics and more. It's also an amazing opportunity for community outreach, promotion, marketing, and networking for businesses serving the chronic illness community. A portion of the funds will be donated to the Autoimmune Association and Breast Cancer Foundation. Tickets are selling fast, so purchase yours now. Reach out to us at www.nurselovesessentials.com.
got it.
So, what when a person brings their child to you and
Mhm.
they're displaying these symptoms, where do you start with them?
Yeah. So I think it's important to have like a really good idea of the characteristics of the pain, because pain and arthritis don't always go hand in hand. Someone with rip roaring arthritis won't always have pain, and someone without arthritis will have a lot of pain. So you have to be very clear in teasing out what's what. And so I listen to the story and ask very specific questions to see, is it more just pain not related to arthritis, or now am I dealing with both together? Right. And a lot of times it is both together, or my joint exam is very important as well. So what am I feeling? Am I feeling puffiness? Am I feeling warmth? Am I feeling restrictions in the range of motion? Are they worse in the morning, better later in the day? Are they having trouble getting out of bed because of the stiffness or the pain? Is the pain brought on by activities? These are all questions I ask, and some parents are like, gosh, we haven't paid attention enough. I'm like, well, that's going to be step one, is the homework to figure out, tell me what's what. So that a lot of it is just in the question and answer session that I have. And then usually most people don't realize this, but I give them something called a symptom tracker, where any symptom that you have, whether it's a joint pain, rash, fingernails turning blue, ulcers in the nose or mouth, I want to know if you can pinpoint what may have triggered that. We may never find that out, but in the process of figuring that out, people are like, oh yeah, this day I did this activity, or I ate this, or gosh, I was around this stressful event, and every single time that happens, I get oral ulcers. So it's my job to help you figure out, what do we need to worry about in terms of medications, and is there something bigger going on, or is this something that's really associated with a certain food or environment or person? So you can kind of start mapping that later on in life. I can't control that part for you, but at least I can teach you to predict what's about to happen to your body.
Wow, this is mind blowing. Like, I'm talking to you, and you're like the superwoman
You're so sweet.
of rheumatology, because these are the things that you want your child to, especially if you're a parent and you have a child, you want someone who is going to really understand even those intricate things that could be playing a role in their illness. For
100%.
me, I had to learn without that particular knowledge. It took me about 10 to 12 doctors to get
Mm,
the diagnosis,
yeah.
but with the what I learned, and I had to learn for myself, was I attention to the types of food I
Mm-hmm.
ate. That's what led me to eating more of of anti-inflammatory nutrition.
Right.
I need to exercise and move my body, especially before the rain comes,
Oh,
because my joints are going to feel it. I needed to know the differences between the intensity and the types of the pain that I was feeling, and could it
mm-hmm.
be more fibromyalgia related or rheumatoid
Right.
arthritis related?
Right.
Where is this pain coming from? And then even the correlation between endometriosis and autoimmune disease,
Right.
how they have found, that the inflammation from that can contribute to the symptoms that I was experiencing.
Right.
What I loved is you spoke about symptom tracking and
Mm-hmm.
journaling.
Yep.
There's an amazing journal that I like,
That's
Mind
it.
Flight Journal.
I'm
It's
gonna write
made
that down.
by a mother and a daughter who are chronic illness warriors who
Nice.
live with autoimmune diseases themselves, and it has a tracker for that,
Uh-huh.
including for your symptoms, how the pain feels, how your emotions are. How did you respond to food and things of that sort, and then a side that actually of it that focuses on positive affirmations and gratitude.
Yeah.
I think that this would be an amazing journal for you to look to
Yeah.
take a look at,
I will. I wrote it
because
down.
yeah, it's I really love supporting the chronic illness community, but the
Sure.
fact that you mentioned that as a part of it. So you talked about that symptom
Mm-hmm.
tracking. How do
Mm-hmm.
you support parents besides telling them to pay attention to those things? What are ways that you support parents and help them to better support their children through new diagnoses?
Yeah, that is very important. It's really case by case. So some parents are in denial at the first visit. They're like, okay, well, we'll see you back and see if that medication really helped. Some parents are like, okay, what's the Juvenile Arthritis Foundation? What can I do? So I give them, I kind of work with them based on what level I'm seeing that they're at. So if they want to get more involved, obviously being in tune with their child. If I sense that any part of this is amplified pain or chronic pain / fibromyalgia type picture, I also educate them on kind of when to not be so is too in tune with their child. So what I always say is do not enable your child to be disabled. So what I mean by that
Mhm.
is you want to encourage them to be as normal as possible. So tolerate activities as much as possible, go to school. Yes, I do a 504 for them where it's a school modification note, asking the school to recognize that they do need breaks, due to their illness or whatever other, like second pair of books, leaving early from class to go to the next class. So I work with the child and I tailor their needs based on that. But the biggest thing the parent can do is kind of be optimistic for the child, right? There's no reason to go home and be like, oh my gosh, this is the end all be all, because that's not the truth at all. It's what can I do to help you get through this? Whether it's let me teach you to give you your medication. I'll be right here with you when your next Humira is due. Tell me how much you want to help. So it's basically helping the parents give the child ways to become more independent, right? So that's a major goal in parenting 101 is our whole job is to
Mhm.
raise children so they can go off and be good citizens of the world, right? And be productive citizens. So part of that process is helping the parent teach the child, okay, this is what you need to do to get towards that. You're going to turn 18 one day, and in the eyes of the law, you're an adult. Mama's
Mhm.
not going to call to get access to the patient portal. It's going to be going to the kid now. So all these little things that we have to kind of prepare you in transition for that. That's like the big milestone in the world of pediatric rheumatology.
Wow. And I see your connection in this, not only as a rheumatoid arthritis warrior yourself, but also as a parent of three
Mm-hmm.
beautiful children. They have an amazing mom, y'all.
Oh,
And then as a doctor who understands the importance of integrative medicine,
sure. Yeah.
I see all of that in what you just said. You said something that is going to stick with me
Mm,
for times to come when you said, do not enable your children to be disabled.
right. And that sounds, when I first came up with that, I was like, am I being too hard? Am I,
Mhm.
it's reality. A lot of these
Mhm.
parents have who wants to see their child in pain? Nobody. So you as a parent feel like you're being protective. And when it comes to the world of chronic pain, I'm not talking about pain from arthritis. I'm just talking about the circuitry of your brain involved in someone with fibromyalgia or chronic pain. Anytime where there's input into the brain saying that, oh my gosh, I'm in trouble, you're just fueling that whole circuit and saying, yes, I am in trouble. Oh my gosh. And then the pain circuits start to fire. So why would you fire that circuit as a parent if you know it's not helpful? It's futile. So you kind of have to paint the picture for them real clear that our goal is to get this child back in school, back functional, fully doing what they were doing before. You can't hinder that process. And sometimes you got to get out of your own way. That's the reality of it. If I would want someone to tell me that if I was doing that to my child. I don't view it as like a negative. I would want to hear the truth.
Whew. And the truth,
It hurts.
it hurts sometimes, but it's real because even before being diagnosed, my mom always taught me. I saw my mom live in chronic pain, and it took
Mm,
her more than 20 years to even get a diagnosis herself for
wow.
her chronic pain conditions and
Yeah.
autoimmune disease. But I saw her push through and work and provide for me and my sister. And the way that she did that moved me when I was in school,
Mm-hmm.
I was working full time and going to school full time,
Wow.
and living on my own at that time. I had moved out when I was 19,
Oh, wow.
and had my own place, not on campus, had my own, studio apartment that I moved, and finally a one bedroom. I'm telling story. Yeah, I'm telling too much. But the point of the matter is, I did all of that and had illnesses I didn't know existed because I saw the example of my mother,
Mm,
and that she kept pushing me saying, "You can do this, Tina. You can do this."
yeah.
Yes, you need to go to the doctor. Anytime I would pass out, she was in her car on her way to the hospital and things of that sort to support me. But she was like,
You
"You
can
can
do
do
this.
this."
And that's what I want the parent to be in this situation, is a cheerleader. That's it. I just
Mhm.
need you to be a cheerleader to say you can and you will get through this, because both of us have the same goal for you, which is getting you back to functionality,
Mhm.
whatever that may be. So the parent's job is to be not a disabler, but a cheerleader,
Yes, an enabler
an
in the
enabler.
right sense.
Right,
We
exactly.
don't want to, and I'm this is going to be like I said, this conversation is going to stick with me for many reasons.
Mm,
Not only because of you being a rheumatologist and all the other things I've said, but the powerful statements that you're making that can really impact the lives of parents with children with these conditions. Children are not only our future,
mhm.
but because we say that all the time. Yes, we believe that children are our future, but we want to raise children who can really support a stronger and better future, no
Correct.
matter what their health condition is.
I think
And
resiliency is the key word, because,
yes.
like, if you're not resilient, especially in the face of a chronic illness, it's
Mhm.
very easy to have bad days all the time. Like, "Oh,
Exactly.
my methotrexate is due. Oh, my joints are hurting. Oh, this," but it's that's why resiliency and just bouncing back from whatever situation that has not gone your way, it's so important, and that none of this is instant gratification. None of it is.
Mhm. I often say, and I'll say it forever, that I am not defined by my chronic illness,
Mm-mm.
but I am defined by my resilience
Right,
and my inner strength.
right.
And we are not physically as strong at times in our lives, but the inner strength that we have, the ability to come back from what seems like insurmountable and unbearable pain and challenges, but to still be able to push forward and have the mindset and the fortitude to accomplish our goals and dreams.
Yeah.
You're an example of that. You've
Thank you.
accomplished so much.
Thank you.
Starting your own practice isn't easy.
Yeah, and also
Um,
leaving my very stable job, and being able to I didn't advertise this at the time, but, like, being on call in the hospital was hard for me because you get woken up overnight, and sleep was a huge trigger for me.
mhm.
So to have protection or accommodations to minimize that as much as possible was a sign of weakness in my head. I mean, in medicine, you go through, you put your head down and you do what you're asked to do. You don't make a squeak. So having to be like, excuse me, my arthritis is flaring again. Can we do something, to modify my schedule? That was hard for me. It was really hard. So
Mhm.
that was also a learning curve, but advocating for yourself allowed me to be where I am today. Otherwise, I
Hey.
think I would be in this hole of just abyss. I don't know.
Well, I want to congratulate you once again on starting your practice,
Thank you.
on also being an example to us autoimmune warriors that you do need to advocate for yourself, even as a doctor. See, that's one
Right.
thing I think that drew people to me was as a registered nurse.
Right.
I'm telling them, you need to advocate for yourselves, and this is how you do it. But
Right.
you're saying, as a doctor, I had to put my health first in
Mm-hmm.
order for me to be better prepared to serve a community of people who need me.
Exactly.
And
And
wow.
you don't see it at the time, but every single time, this is what gives the best results. You have to advocate for your health. Without your health, you have nothing. You can't get up
Mhm.
to go to work, you can't take care of your children, you can't do anything you enjoy. Fix that first, and then everything else will follow.
Amen.
Oh,
Well, I want to thank you so much for joining me today. And
you're
before
welcome.
I go, because this, I'm telling you, I got to go back and listen to this myself. So this is amazing. Before you go, I would love for you to tell us again, where can we find you and how can we access your services, even on social media? What are your platforms?
Yes, yes. I'm on Instagram. So my Instagram handle is Rheum to Grow TX, and Rheum is RHEUM. And my Facebook name is Rheum to Grow TX as well. A little bit on TikTok, not really super involved in TikTok yet, but it's also Rheum to Grow TX. And then my website is www.rheumtogrowtx.com. And for me to see patients, you have to be in Texas. My medical license is currently restricted to Texas. However, if I get an influx of patients from a certain state, I can look into getting a license for that state. So then I can do virtual consults as well. But right now I'm limited to Texas. So either you can come here, or we'll have to think of creative ways to figure out how to get you to Texas. So, um, I'm only 3 weeks in, so we have some time.
Let's work that up. Texas, light her office up. Okay. This is an amazing doctor.
Thank
And
you.
we look forward to seeing you grow even more because there is room to grow.
Thank you.
And we also look forward to having you again on this podcast
Sure.
because you and I are friends for a long time to
That's
come. I
right.
can feel it. So
You're so sweet.
I want to say to you again, thank you. And to the audience, thank you so much for listening in on this. What I want you to do is to please follow Dr. Singla and check her out. In addition to that, come back to us, like, subscribe, share, comment on this podcast episode. It means so much. The other thing is, remember this, my sisters, we may be inflamed, but we're still here. And as long as we are here, we might as well thrive together because inflamed sisters thrive together always. Have an amazing
Love
day,
it.
everybody. Take care. Bye
Bye.
bye.